Hello, my name is Neil Forbes. I am a Royal College of Veterinary Surgeons specialist in zoo and wildlife medicine, avian, in other words, bird medicine. I've worked in bird practice, referral practice, academia for 34 years. And I've been a user of F10 products and a great believer and advocate for them for the last 20 years. I'm delighted to say that now, having left clinical practice, one of the roles I am fulfilling is as veterinary advisor for health and hygiene. And I'm very pleased today to have the opportunity to share with you a presentation on the etiology, prevention and treatment of bumblefoot in birds, with particular reference to the application of F10 in those situations. So first of all, before we get into the bumblefoot, let's just consider what makes F10 so very different. Well, as a starting point, we have safety testing for all finished products. That means after the product's been manufactured, where it's at a stage ready for supply to yourselves and use, we have testing of those products at that stage by government accredited quality controlled laboratories for safety in relation to skin, ingestion, the cornea of the eye and the respiratory system. We also have efficacy testing also carried out on finished products by government accredited quality controlled laboratories. There is also a considerable amount of information, testimonials, safety, all the safety and efficacy data, the application instructions and much more is available for you on the health and hygiene website. So let me just reiterate that if you look at other manufacturers, disinfectant manufacturers' websites, you'll see that they state their product is safe and is effective, but they don't make those safety and efficacy certificates available to you. Health and Hygiene is an ethical, an evidence-based and a moral company who believes in sharing with you the independent quality controlled evidence that actually these products are both safe and effective, and that is pretty unique in this particular market. So there's a range, F10 has a range of quality products that you can have confidence in, both in terms of safety and efficacy. All the test result certificates are available via this website link here. The full details of dilution rates and contact times specific to the temperature, the pathogen that you are likely to be challenged with are available on this website link here. And the application guidelines are provided for different species that you're dealing with, different clinical situations are available at this link here. So I believe it's true to say that health and hygiene provides added value to all the products across its range, with training and education of distributors, clients and users with this and similar presentations, together with that comprehensive fact-packed website. If there is more information, if there are more presentations that you feel will be beneficial and useful to you as a distributor or a user, then we would be delighted to hear from you. So focusing now on bumblefoot, well, the first question is, well, what is bumblefoot? Bumblefoot is technically a Pododermatitis. So it's inflammation of the skin of the foot. It's a common and serious and potentially debilitating disease of captive falconiforms and other birds, including waterfowl, penguins, and others. The disease is often referred to as being refractory. In other words, it tends to reoccur, and very often the clinician gets blamed for not solving the problem. And what I have to say there is that typically there is an underlying husbandry problem, which you as the clinician must uncover. You must resolve, find it and resolve it, because otherwise it will reoccur, and sadly you will get blamed for having not solved the problem. So typically bumblefoot is inflammatory. It typically infects there are lesions, infected lesions in the ball of the foot or on one or more toes. Typically it'll be the first digit, that's the back digit, or the outside digit, that's the fourth digit. It's commonest in larger species of raptor, and of course we all know that the females tend to be 30% bigger than the males, so it'll tend to be female birds of prey of the larger species. So of course the female gerfalcon is at the top of our list in terms of incidence. Tends to be chronic, progressive, invasive and disabling, and obviously that stands to reason. The lesion is underneath the foot. As soon as you have swelling of the foot and the bird is still standing on it, it becomes a vicious circle and it will tend to get worse and worse and become more invasive and disabling. Frequently recurrent and stated to be unresponsive to therapy, but as I said before, this typically means that the underlying husbandry problem has not been resolved, and that is why it tends to reoccur. It's certainly more serious in falcons compared with hawks, broadwings, eagles or owls. And it's true to say that it occurs in captive birds, irrespective of whether they're wild caught or captive bred. It is the fact of the bird living in captivity that increases the chance of that bird suffering from bumblefoot. So it's true to say it's very rare to find in wild birds. In fact, traditional Middle East falconers, if they have a bird with bumblefoot, usually the treatment of choice is release the bird. And as soon as the bird is out there flying in the wild, flying more, that means it's increasing the blood supply to the foot more. It has a choice of where to sit, and because it's sitting, eating, pooping in different places, the chance of it sitting on a contaminated perch, and of course Staphylococcus being the most common pathogen coming from man, if the bird is away from man, it's less likely to get contaminated with Staphylococcus. So rare in wild birds. But certainly here we have a female gerfalcon, a white gerfalcon. This would be the bird that would be highest in terms of risk of aspergillus. So commonest in falcons compared with hawks, owls, eagles, broadwings, particularly the heavier the falcon, the more likely it is to happen. In terms of etiology, we have a thick layer of stratified squamous epithelial skin with keratin on the base of the foot. The plantar surface includes hard papillae, and their function is to spread the weight, to distribute the pressure across the plantar aspect of the foot. There are two main etiologies in terms of the etiology. One is a penetration, so that could be a thorn, a talon, teeth, so that the thorns would be occurred during flying. The teeth would be penetrations from quarry that they catch. The talons may well be the bird's own talons when it's grasping quarry or getting upset because it's trying to evade being caught in an aviary. But those are only responsible for 5% of the causes. 95%, the vast majority of causes, it's all down to avascular, in other words, pressure necrosis, rather like grandma lying in a hospital bed, taking pressure on the points of her hips and so forth. And once that pressure is there, then the underlying tissue becomes devitalized, the skin loses its blood supply, and therefore the defense mechanism, the skin protection, the barrier becomes compromised, and pathogens that are commensal on the skin then have the ability to migrate through the skin, giving rise to an underlying cellulitis, then by causing swelling underneath the skin, making the pressure even worse. So the factors are hygiene of perches, the perch surface, the level of inactivity of the bird, excessive weight bearing resulting in pressure necrosis, and the migration with pathogenic bacteria through the skin. So we have a failure of epidermal defense mechanism, the migration of endogenous pathogenic bacteria into the damaged tissue, the infection giving rise to tissue swelling, increased pressure, and further necrosis. Now, it's true to say that commonest pathogen giving rise to bumblefoot is Staphylococcus aureus. And of course, Staph aureus is not a natural inhabitant of bird skin. It shouldn't be there. So what's the source? Well, it's pretty straightforward. It's human skin. We as humans have staph on our skin the whole time. As we handle birds of prey, as we handle their food, we handle their feet, they sit on a glove which we've handled with our skin. We are transferring Staphylococcus from the falconer's hands to the gloves and to the bird's feet, and that is causing a great increase in risk of bumblefoot. So what's the solution? Well, in terms of falconer's hands, the falconer needs to use F10 hand wash to sanitize their hands prior to handling any birds, their food, or their gloves. We need to decontaminate gloves, gauntlets, with F10 SC 1 in 250 diluted spray. We need to regularly decontaminate perches with F10 SC 1 to 50 spray, and I would suggest you should be doing that on a every other day basis, and then on a regular basis every 2 to 4 weeks, using a deep clean of the perch surface, taking the perch surface off, maybe it's AstroTurf, putting it through a hot wash on a washing machine, including a F919 SC degreaser, and then spraying with F10 SC 1 in 250 spray before going back onto the perch and before it's being used by the birds again. And then lastly, but really, really importantly, is, okay, we've done everything we can to prevent contamination of the bird's skin with Staphylococcus, but then we should accept that actually it can still occur. So actually using F10 germicidal barrier cream rubbed into the falcon's feet twice a week will control any Staphylococcus aureus that happens to get onto their feet. And that's particularly important with falcons rather than other birds. Firstly, because bumblefoot is more common in falcons, but part of the reason why it is more common is because falcons specifically have a different pathophysiological response to Staphylococcus toxins compared with other species of bird of prey, and that's why they have a much worse time with bumblefoot. So barrier ointment, twice a week, I would suggest twice a week, rubbed into the skin to control the normal bacteria on the skin. At the same time, checking for signs for any swelling, discoloration, or heat that would indicate early stages of bumblefoot. If you are applying dressings to the feet, and we would always advise, if there is any reason for a bird to take more weight on one foot than another, you should always apply a dressing. And what we would use is a dense foam ring donut or corn plaster shaped dressing. In other words, taking the pressure on the base of each digit away from the ball of the foot, so taking weight bearing off the ball of the foot. So if a bird's had a broken leg and you do surgery, you put a preventive dressing on the other foot. If a bird has bumblefoot on one foot, yes, you dress that foot, but you also put a preventive dressing on the other foot. However, the risk is in putting a dressing on a foot, especially where it's in a warmer climate, there is the risk that underneath that dressing, the foot becomes hot and sweaty, a bit like the human foot that's hot and sweaty inside a shoe with a sock on it, and then leading to a fungal infection with Candida. So we would always advise, if you're going to put a dressing on a bird's foot, always clean the foot and then apply F10 barrier germicidal cream on the foot before you apply the dressing to prevent or control any fungal or bacterial infection that might otherwise occur underneath that dressing. Really important thing. It's all about prevention. Don't wait for it to cause a problem, prevent the problem. In terms of prevalence, as we said before, the condition is very rare in wild birds because they don't have any contact with humans, therefore no exposure to Staphylococcus, because they're more active, because they have improved pedal blood supply, because they're out flying more often and they've got less weight bearing. They have a choice and a variety of perching surfaces, therefore the perch tends not to get so contaminated. There's no build-up of pathogens on the perch. So that is the explanation. But it means that once we take the bird into captivity, we have to understand the risk that is posed to that bird by standing on those perches, being in close proximity to man, and the risks, and we need to negate those risks and prevent the bumblefoot occurring. In terms of clinical signs, success requires early diagnosis and treatment. Bumblefoot is defined by severity of classes 1 to 3 or 1 to 5. I prefer personally to use the 1 to 5 categorization, and it ranges from localized superficial with no infection through to deep-seated with structural changes eventually and with severe osteomyelitis. So just looking very quickly through here, Class I Bumblefoot, a discrete localized superficial lesion without any infection. So here we can see here a little bit of erythema around the medial aspect, but basically it's a superficial wound and there is no infection there. Now applying F10 germicidal barrier ointment every 3 to 4 days and improving the husbandry will resolve that without any need for systemic medication. We move on to Class II, and we can see we have a lesion on the base of digit 4, and we can see that this area here is swollen, so there now is infection. There's localized swelling and infection, and we would always suggest collect a sample for culture sensitivity before you start antibiotics, but start antibiotics at the same time. Apply your F10 germicidal barrier cream every 3 to 4 days. Put a pressure relieving dressing on the foot to relieve any pressure from that aspect there, and change that dressing every 3 to 4 days and reapply the F10 germicidal barrier cream before you redress it. Moving on to Class III, here you can see a generalized swelling across the whole of the base of the foot. We have a discharging wound here. So again, collect a sample of culture sensitivity, commence antibiotics, but also apply F10 germicidal barrier ointment every 3 to 4 days, improve husbandry, apply that corn plaster dressing, but leave a hole in the middle of the dressing, to relieve the pressure on the ball of the foot, but also to allow you to keep applying dressing in between your dressing changes. And if there is no improvement on that medication, then you will need to consider surgery if it's non-responsive. So by the time we get to Class III, the infection is well established. There are typically structural changes have occurred. So as I say, if it's non-responsive to conservative therapy, it should be treated by complete surgical removal of all infected tissue, followed by first intention healing. Class III treatments traditionally carry a good to guarded prognosis. So here we have the surgical removal of all diseased tissue, and then closure of the wound, maintaining the structural integrity of the tarsal pads, these pads on the ventral aspect of the toes and around the base of the foot. We need to keep them in the correct position, and we close that and we put a pressure relieving dressing, but of course applying our F10 germicidal barrier cream to the foot before we put the dressing on. Moving on to Class IV Bumblefoot, here we have established infection with gross swelling with involvement of deeper vital structures, tendons, and underlying structures, potentially bone as well. Here it's important to take a radiograph, and you certainly will need surgical exploration. You'll certainly need a swab for culture sensitivity. It is by this stage a chronic condition with typically a tenosynovitis or arthritis or osteomyelitis as an ongoing condition. So we have a guarded to poor prognosis. So this is day 1 when the bird is presented. We have large gross swelling of the base of both feet with open discharging wounds here. Class V is an extension of Class IV with crippling deformities. Previously, these were considered to be inoperable, and it was advised the birds would be euthanized. But both Class IV and Class V cases have a guarded to grave prognosis. There was some research I conducted with Dave Rempel from the Dubai Falcon Hospital when he was working there, and we developed a technique with the use of antibiotic impregnated polymethyl methacrylate beads, bone cement beads, inserted into the foot. So same procedures before, culture sensitivity, and then surgical removal of all the infected and devitalized and scar tissue, and then placing beads in the foot, either permanently or for a specific period of time, as a way of locally treating that infection. Again, of course, with pressure relieving dressing and use of barrier cream underneath the dressings. And that actually did massively improve the chances of being successful with these cases. So here on the left, we can see a massive soft tissue swelling around the foot, telling us the problem's been going on some time. There are some bony changes with a change of lucency here. And on the right here, we can see a really severe osteomyelitis case with loss of bone from the distal metatarsus as well as the proximal digits here. This case would be absolutely untreatable, and that's the value of taking the radiograph, so that if it is an untreatable case, you can relieve the welfare concerns and sadly put the bird down. So here we go. Here is a pressure relieving dressing on a little kestrel. So we have a ring donut shaped dense foam pad on the bird's foot, relieving pressure from the center, leaving a little hole open so we can keep applying our F10 germicidal barrier ointment on a regular basis. So we relieve the pressure, we prevent fungal infection occurring under the dressing, particularly in hot climates, and the F10 will of course also control any yeast and bacterial infection on the skin. So a few tips and tricks, basic principles. Falconers to apply F10 hand gel before working with birds each day and after handling bird food. Spray the inside and the outside of gauntlets with F10 SC spray 1 in 250 dilation before and after use each day and before and between different birds. And that's all about preventing the transfer of infection from one bird to another bird. To spray their perches daily with F10 SC 1 in 250 and to submerge for 15 minutes the perch surface at least once or twice a week, and then every 2 to 4 weeks to use F919 SC degreaser on the perch material to remove that lipid surface layer prior to redisinfection and reuse. To apply F10 germicidal barrier cream to falcons' feet twice a week to control any staphylococcus that has managed to get onto their skin. And then remember to use a pressure-saving dressing post-operatively or any situation where there may be excessive weight bearing on the base of the foot. Use that dressing, but with F10 barrier ointment applied to the skin before you do so. Always maintain antibiotics for sufficient time. Do not leave dressings on without managing hygiene and changing on a regular basis, applying that F10 germicidal barrier ointment to the skin each time before you reapply the dressing. Antibiotic impregnated polymethyl methacrylate beads can be extremely useful in class 4 and class 5 cases. Where we have bumblefoot in waterfowl, different situation really. Waterfowl are not designed for walking, they're designed for swimming. So typically if you see bumblefoot, this will be associated with either an inadequate amount facilities or time for the waterfowl to be able to swim, in other words, take pressure off their weight, or that the substrate in their enclosure where they're living is rough or abrasive, such that the skin is becoming damaged. So in terms of managing bumblefoot in waterfowl, it's all about giving them more time to swim and take the pressure off, making sure the substrate is not abrasive, and treating it with the same techniques we use in raptors if necessary. The one difference is once you've operated on a waterfowl, you don't put a dressing on, because if it gets wet, it'll get soggy and that will cause a problem. So you just simply sew the skin back together, wait for the skin wound to heal, typically 6 to 8 hours, and then allow the bird to get onto water, sanitizing the water by putting F10 SC at 1 in 500 dilution in the water, so that the water is kept nice and hygienic. Moving on to penguins and similar birds, most often when they get bumblefoot, that's related to walking on a rough abrasive surface or having an excessive number of birds in the same group. So there's an increased stress and adverse reaction between the individuals, so they keep turning and twisting and moving and causing excessive abrasion on their feet. So just in case you forget, the basic principles: falconers apply F10 gel before working with birds each day. Spray inside and outside the gauntlet with F10 SC before and after use each day and between different birds. Spray perches with F10 SC daily and immerse for 15 weeks weekly, and F919 SC treatment of perches every 2 to 4 weeks. And then applying F10 germicidal barrier ointment to falcons' feet twice a week to control Staphylococcus aureus. And then we have some useful references for you. We've got all the sort of subjects that I've referred to already. I would particularly draw your attention to the health and hygiene bird of prey application. If you click on here, that'll take you straight to the health and hygiene website for those uses there, but lots of useful references. I do hope that you found this presentation useful. Do share it with colleagues and other bird of prey keepers. And if we can be of further assistance to you with other presentations, or if you believe this presentation could be improved, we would be very grateful to hear from you. And do please take time to have a look at other relevant presentations, webinars on the use of F10 in any other situations in which you're involved. Thank you very much, and hope to see you again. Thank you.